Hi students, Ms. Thomas here again. Last class we spoke about human resource development through education. Today we're going to talk about human resource development through the provision of healthcare. Now I'm trying to keep these lessons under 10 to 15 minutes, so I'm going to see if I'm going to achieve that goal today. Remember, last class I asked you, what would you do for your own children to develop them, to bring out their talents, bring out their gifts and natural abilities? You would provide education and you would also provide healthcare. The government does the same. So, we're going to go through the provision of healthcare to improve the human resource. We have curative healthcare, primary healthcare, public healthcare. We're going to go through all of these today. Healthcare, like education, is provided by the government and by private institutions at 3 levels: primary, secondary, and tertiary. Healthcare is provided free of cost or at a minimal charge. Private healthcare is more expensive. Primary healthcare. Primary healthcare is also known as preventative healthcare. And this, to me, it's the most important because it teaches you and educates you on how you could prevent yourself from getting certain illnesses. Preventative or primary healthcare is provided at the national level and is concerned with the prevention of disease. Please take note of this. It is concerned with the prevention of diseases and other form of illnesses, and it promotes wellness. So some of the aspects that would be covered, that would be part of primary healthcare, would be the promotion of breastfeeding. You all know that breastfeeding of babies prevents them from getting serious illnesses and keeps them at optimal health. The provision of immunization. All of us were immunized from many deadly diseases that would have killed us years ago or disabled us years ago. Example, polio. Your parents would have taken you to our healthcare institutions and you would have gotten a polio vaccine. You would have gotten yellow fever vaccine, rubella vaccine, diphtheria vaccine. You probably don't know that you're safe from diseases because you had these vaccines given to you as a child, right? All that will be part of preventing illnesses. Another aspect of preventing illnesses would be promotion of good hygiene. Like right now we are experiencing a pandemic, COVID-19. One of the preventative measures that we use to prevent ourselves from contracting the illness would be regular washing of hands, sanitization of our hands, wearing of a mask, so droplets won't transfer from one person to the other. Education about proper garbage disposal and storage. Our garbage disposal is a very important aspect of our healthcare. We must be thankful for our persons who work in garbage disposal and garbage collection, because without them, what would our life be? Disease would be prevalent, disease would spread. Can you imagine life with a month of your own garbage around you? No, that is It's difficult to even fathom. The government provides safe and portable drinking water. That is part of preventative healthcare as well. The provision of safe drinking water. We take it for granted sometimes that you just turn the tap on and you have water. But there are many countries in the world where that is not possible, or the water is not safe. So the provision of all these things prevent, so now you're able to wash, upkeep hygiene, proper hygiene. You're able to wash your fruits and vegetables, bathe, and many other things that we do with water. The provision of care for the elderly. Pre and postnatal care. Pre and postnatal care has to do with care of pregnant women. Before the baby is born and even after the baby is born. Provision of dental and vision health. The government provides dental and vision services through the health centers and hospitals. The promotion of good nutritional practices such as a healthy lifestyle and exercise. So, some of primary healthcare is in your hands, where you decide what is the best food for you. So, eating fast food every day, soft drink every day, that is not up in keeping with preventative healthcare. So, exercise is also very important. You must exercise, and that keeps you healthy and strong. So just like proper nutrition keeps you healthy and strong, exercise keeps you healthy and strong, and all that has to do with primary and or preventative health care. You also need to rest. Rest is very important. The body needs to have adequate amount of rest so it could repair itself and have you alert so you could function properly and be the human resource that our country deserves. Then we'll go on to secondary or curative healthcare. Secondary healthcare is also called curative healthcare. Secondary or curative healthcare services are concerned with the early detection, treatment, and cure of diseases and other illnesses already contracted. So this is not preventing it. Now, preventative or primary healthcare has to do with preventing it. Now, this is for persons who have become sick. Secondary or curative healthcare has to deal with persons who have already become sick or at the start of their illnesses, early detection. Some of the services that secondary or curative healthcare would, and think of the word curative as to cure. That might be a good way for you to understand that. Services include maintenance of hospitals, clinics, health centers which provide curative service. The government ensures that every district in Trinidad and Tobago has, and even throughout the Caribbean, I'm sure it's not just Trinidad and Tobago, has proper health centers, functioning health centers, and the hospitals for the citizens. Diagnosis and treatment of diseases and other ailments. Many of us who have diabetes or hypertension didn't know that they have it, but it was discovered and diagnosed at the local health centers. And of course, they will plan a course of treatment for you to make sure that you maintain good health, nutrition, exercise, so your illness won't make you deteriorate to the point, where you can't function or be be the most effective human resource that you could be. Performance of corrective surgeries. Performance of corrective surgeries. Example, persons with cataracts. They could go to the hospital and get their surgeries to remove cataracts to improve their vision. Persons who have probably tonsillitis, they could go to the hospital and get their tonsils removed, or dental surgery. All these are secondary or curative healthcare provided by the government. Another service that is offered, it is radiotherapy and chemotherapy for our patients with cancer, different forms of cancer. One of the treatment that they get is chemotherapy, and that is also provided by the secondary health care system. Provision of counseling and rehabilitation services. So persons who have addictions or persons who have experienced an accident could get physiotherapy, and persons who have suffering with some form of addiction could get counseling and such like. So curative healthcare or secondary healthcare has to do with early detection and treatment to cure your disease, or at least make sure that you're healthy enough so you could continue functioning properly as a productive citizen of Trinidad and Tobago and beyond. It's not only Trinidad and Tobago. Then we have tertiary healthcare. At this level, the concern is with the treatment, care, and rehabilitation of persons who have already been diagnosed with disease. So this is persons who are already very sick. So this is not preventative. So this is different from preventative or primary healthcare, where you're dealing with preventing it. This is different from secondary or curative healthcare, where you're concerned with early detection and treatment. This is for persons who are well advanced in their illness and they need special treatment and rehabilitation for those who are sick. Rehabilitation care can be provided by public health institution, as well as it could be done privately. Of course, you know that private healthcare is paid healthcare, paid by out of your pocket, which of course will be more expensive. Public healthcare would be paid through the taxpayers' dollars. Now, so just to recap, development of the human resource through healthcare, and there are three different types of healthcare. Primary healthcare, also known as preventative healthcare. Then you have secondary healthcare, which is known as curative healthcare, to cure you. And then you have tertiary healthcare. And so that wraps up our lesson for today. I hope that this was enlightening to you, and I will see you in the next class. Take care. Bye.